I see a patient and he has a heart problem, I need a stethoscope, I need, maybe an echograph, I need to bring him to an hospital, I need a surgical team, then I treat him. Then if you want to bring that for the global population, what do you need? Of course you need a hospital, but you need electricity, you need infrastructure, you need roads to go to the hospital, you need cars, transportation.
What I find most exciting is how you invest in new technologies, like in the mobile health sector, how you use smartphones, how you use tablets, and how you are much more innovative in this area. I mean, there are so many medical devices you can combine with smartphones, and where you can give them these easy-to-use interfaces to health workers out in little villages.
We host a very interactive dinner where we focus on three discussions. We focus on payment technologies enabling claim management. We also looked into identity management and digital identities, and we look into using data to hack and transform supply chains. So a lot of interaction at the dinner, a lot of shifts that we saw last night from collective intelligence into collective action.
And I mean, there are fantastic startups who do a lot of things, but what is still missing is how to integrate all of this.
What we also realize is that from an economic and business model perspective, those technologies, which can be deployed in the healthcare sector, can also be reused on use cases other than healthcare. So we started to think about how we can use payment solutions and value exchanges, that we call them, as well as identity programs in the areas of education, in the areas of social services disbursement.
You see, this is where I like to focus on, to teach people how to provide open national platforms which are based on open standards, so that all these little applications can integrate and deliver data to the same national platform.
We also started to realize that our technologies, which are usually used in the financial services transactions, can also be applied to the healthcare sector. We look in particular at three major areas: enabling payments in the health sector, using identity solutions and programs to make sure that people have access to their services, and also using data analytics to understand how we can streamline and make supply chains much more efficient.
So all these, side determinants are not side anymore.